Welcome, I am Dr. Padda. In my 30 years of clinical practice, spanning anesthesiology, interventional pain, and metabolic health, I have arrived at a singular, uncomfortable realization. Modern medicine is obsessed with the symptom, yet woefully ignorant of the signal. We have built an entire industrial complex on the assembly line model. You present with back pain, you get an injection. Knee pain, you get an injection. When that inevitably fails to fix the underlying pathology, we escalate to surgery. We are treating the signal, the pain, as if it were the diagnosis. But pain is not a diagnosis. Pain is a biological warning. It is an indicator that your body's terrain, the structural integrity, the metabolic environment, the nervous system regulation, has drifted out of balance. At Regenerative, we do not inject and ignore. We intervene intelligently. We exist to fix the terrain that allowed chronic pain to take root in the first place. Today, I want to discuss a tool that, when calibrated with absolute precision, is one of the most powerful interventions we have: whole body vibration, or WBV. If you go to a gym, you see vibration plates used as a gimmick to burn calories or ease muscle soreness. That is the shallow end of the pool. To understand the clinical utility of WBV, you have to look at the cellular level. You have to understand mechanotransduction. Mechanotransduction is the process by which cells convert physical force into biochemical signals. Every cell in your body, from the osteoblasts in your bone to the fibroblasts in your tendons, is hardwired to sense the physical environment. When you apply controlled, precise mechanical oscillations to the body, you are not just shaking muscle. You are physically deforming the cell membrane. This deformation tugs on the cytoskeleton. It opens stretch-activated ion channels. It triggers the MAPK/ERK pathway. You are effectively issuing a command to the cell to synthesize new protein, to lay down bone matrix, and to increase collagen production. You are using physics to reprogram your biology. But here's the critical analytical distinction that most clinics ignore: the Arndt-Schultz law. In biology, the dose determines the outcome. A weak stimulus does nothing. An optimal stimulus excites physiological activity. An excessive, uncalibrated stimulus becomes inhibitory. It triggers a stress response, elevates cortisol, and creates systemic inflammation. When we prescribe WBV, we are not hitting a button. We are calculating. We look at the hertz, the frequency. We look at the amplitude, the displacement. If I am treating a patient with chronic knee osteoarthritis, I am not trying to exhaust their muscles. I am trying to restore proprioception and synovial fluid health. I need a protocol that stimulates joint lubrication and neuromuscular synchronization without causing cellular fatigue. We use clinical-grade hardware because the noise of cheap commercial plates is actually counterproductive. It creates chaotic vibrations that the nervous system cannot integrate, leading to sensory overload rather than therapeutic gain. Our protocols are designed to trigger the tonic vibration reflex, a rapid, involuntary muscle recruitment that restores stability to weakened joints. And this is why it is essential to our orthobiologic practice. If you are a candidate for a regenerative injection, like PRP, your tissue needs to be ready. If your joint is stagnant, inflamed, and metabolically clogged, the injected cells will not survive, and they certainly will not thrive. This is our stack. We use high-intensity laser therapy to address the mitochondrial dysfunction, effectively recharging the cellular battery. We use whole body vibration to address the mechanical signal, improving blood flow, proprioception, and structural readiness. We are preparing the soil. By the time we move to the orthobiologic intervention, we have lowered the inflammatory noise and cleared metabolic pathways. We have created a structural environment where regeneration is not just possible, it is probable. This requires a shift in mindset. It requires you to stop looking for a quick fix and start looking for a long-term rebuild. Medicine is an analytical discipline. It is not a guessing game. It is not a checklist. It is a precise intervention based on the data we gather from your body's unique signal. If you are tired of the assembly line approach, if you are tired of being a number on a chart, it is time to look at the terrain. We are here to fix the system, not just the symptom. We are physician-led, data-driven, and outcome-focused. That is the Regen.MD standard. I invite you to learn more about how we can help you regain your structural and metabolic integrity.